Good morning, everyone, and happy Monday to you. Thank you for joining again in the conversation about the transformation of mental health. And in particular, we have been talking about the power of social work in that transformation. I'm Karen Dubin with Sweet Institute, and I am here to facilitate part of a conversation as a bigger process that we're currently looking at in terms of what a transformed system of care would look like. What does it mean? What does it mean for us as individual clinicians and who it is that we are, how it is that we show up, what voice we think we have as it pertains to the transformation of mental health and what that might look like for us and for our clients alike, as we all may be recipients of different forms of care. And so what we've been doing in this particular video series is that we have been using one of our articles as a launch pad for some of the conversations about the transformation of mental health. All of this leading to, and by all of this, it's the articles that we publish every week about social work power and about the transformation of mental health. It's the conversations that we have, that Sweet has been taking on with different clinicians about what their experiences might be and what it is that they may envision, which is part of what we're going to be talking about today in terms of what a transformed mental health system looks like. Our social work power certificate course that's currently running, where you can come to one or all of the sessions. And of course, leading all to a panel that is going to continue to launch the conversation of the transformation of mental health in different kinds of ways. So today, what we're going to look at, we've been using, as I said, we've been using one of our articles to really begin having these conversations. And this is the article here. It's the role of social workers in transforming mental health. And so we've been looking at this particular article and taking it piece by piece to just kind of examine what comes up in the different elements of it. What are the gaps? What are the barriers for us? Also, what are the things that we are actually, primed and, primed to address because of our roles as social workers and because of the unique opportunities that we bring to the table based on how we engage in the kind of work that we do and the opportunities that we have that are really about all the different systems of care that we are present in and all the different kinds of populations that we work in and the different ways in which we get to do that. So today, what we are looking at is number 8, which is designing innovative strategies. Architecting strategies that foster innovation and drive optimal shifts in mental health systems is a critical responsibility. And, it's a conversation that I think we had when we first started talking about the transformation of mental health through social work in the tendency that we may have to look at things like the current systems of care and how they're operating and see how we can improve those. Which has its merits, right? It has its values and it has its important pieces to it, because if there are things that are happening within those systems that work, why rewrite or reinvent the wheel when we have something that works? But then it also requires us to think more broadly or to actually look beyond how we may be thinking about it, looking beyond what's familiar. I think that might be more of what I'm trying to communicate in terms of, the opportunities to look beyond what's familiar so that we can get to the kinds of things that might really be innovative. And so what would that look like? Looking at how maybe different systems of care, it may not be mental health systems of care. It may be more of a health system, seeing how the health system does things, seeing how and seeing what works and what doesn't work about that, and transforming and using that as an opportunity for us to expand on. It may be how another country or a town or a village or a geographic location, how they work with individuals around mental health care. Now, and again, I want to make sure that when we're thinking about mental health care, that we're also thinking about mental health care in the full expansion of care, that it's mental, that thinking about it from a holistic approach, that it's not just about physical care and it's not just about mental health care, but it's about how both kinds of care are important in our own mental health and our own mental well-being. So really thinking about different strategies that may be out there that would be modified, but really allowing ourselves to think beyond that and be in a place of innovation, like real innovation. And what would be some of the ingredients? What would it take for us to really be innovative, so that these optimal shifts are present? Like, really and truly, if we think outside the box, nothing out of bounds, we just allow ourselves to think beyond the current ways in which we are operating and the current ways in which that we are providing care, and allow ourselves to be creative and innovative and really and truly think beyond what currently exists. What would that be? What would we have? What would we come up with? So I'd love to hear from you about what are some innovations that you're thinking about in terms of how to transform these systems of care so that they can optimally, so that they can operate in the most optimal way possible. So let me hear from you. Put your comments below, and I look forward to seeing you on Wednesday as we continue our conversation about the transformation of mental health, and next Monday as well. For everybody who is celebrating the Thanksgiving holiday, I wish you all a wonderful and grateful Thanksgiving. And for anybody who is choosing not to celebrate, I wish you a wonderful and grateful rest of your week.